The rotator cuff and rotator cuff injuries are relatively complex.
At Mayo, we have the Rotator Cuff Specialty Clinic, a collaboration of providers, both orthopedic surgeons and non-operative sports medicine providers.
The rotator cuff is actually a group of 4 muscles that wraps around the shoulder and keeping that joint stable.
So the common injuries that occur are tendinopathy, which is just a fancy word to kind of say wear and tear, as well as tears.
So it starts out with just inflammation, which is irritating, and gets some swelling in there, and that can be painful. And it progresses to become small little tears, and eventually if that keeps going, it can progress to large tears.
It's difficult for a patient to determine what kind of tear they have. The partial thickness tearing, usually they have more pain that causes weakness. So it hurts, they don't want to move, but their strength is there at baseline. Versus if someone has a more severe tear, such as a complete tear, they may not be able to even move their arm.
We have to have a team that can help make the right diagnosis and lay out the right treatment plan.
The treatment strategy for tendinopathy versus a small tear is the same. So we would start with physical therapy.
The next is in a category of things like injections and orthobiologics. There's been a lot of developments in recent years using things like PRP, which is platelet-rich plasma,
where we draw a sample of the patient's blood, concentrate the parts of the blood that we want,
and we process that in a centrifuge and put that platelet-rich plasma into the area of body that needs to be treated.
If there is a full thickness tear, oftentimes that may mean that a person may need surgery.
And some, probably the most simple, would just be a very small arthroscopic debridement. So that's where we go in through a few small little incisions with small cameras and clean everything up. The next level up from that would be a formal repair, still arthroscopic, and we actually sew the tendon back down to the bone. There's a group of patients who have what we call irreparable rotator cuff tears. So in those scenarios, often what we'll do is repair the tendon the best we can and then use a graft from a donor to fill in the remaining defect.
After someone has a surgery, then physical therapy is a very important part of that recovery.
We have a specialized team of experts, physical therapists, athletic trainers. We not only want to treat the injury, we want to help prevent that injury from happening again.
And I think that it's important that we approach them as a unique individual rather than sort of taking a one-size-fits-all approach. And I think that the way our culture is built at Mayo, that using the entire team allows us to understand that individual patient's needs that'll help them get back to their goals.